5:30, more controversy tonight over what's become an all too popular trend. More young people and even adults are vaping instead of smoking, but doctors are finding it can cause severe lung problems. Channel 3 Eyewitness News reporter Susan Raff shows us what Connecticut doctors are seeing. Susan.
Erin, health officials are now seeing a sharp new increase in the number of severe lung illnesses, possibly linked to vaping. The Centers for Disease Control is now aware of 153 cases of severe lung disease found in 16 states across the country, and Connecticut is one of them.
I could just feel my heart just pounding out of my chest, going 100 miles an hour.
For 10 days, machines kept 17-year-old Tristan Zofield alive, while doctors tried to learn why this formerly healthy, athletic teen's lungs were failing.
The day they intubated him was probably the worst day of my life. They did the x-rays. It was completely cloudy all the way through the lungs.
Multiple tests found no clear diagnosis, but then doctors concluded that Tristan's vaping habit, which his parents didn't know about, might be responsible.
It's becoming a health crisis.
Dr. Stephen Prunk is the director of pulmonary medicine at the Hospital of Central Connecticut.
The symptoms that people have with vaping could be cough, phlegm, shortness of breath, chest discomfort.
He says symptoms are a sign of inflammation in the lungs, and there's an epidemic. 20% of high school freshmen are now vaping. The CDC says no specific vaping product has been conclusively linked to all the illnesses. In a statement, leading e-cigarette manufacturer Juul says it's monitoring these reports, and we have robust safety monitoring systems in place. Reporting also suggests the teenagers were vaping both nicotine and THC, a Schedule I controlled substance that we do not sell. Tristan's doctor says the scarring in his lungs could have a long-term effect, but he's expected to live what she calls a fairly normal life. With this latest report, the CDC is putting the nation's healthcare workers on alert about the spike in lung illnesses and to be on the lookout for their possible connection to e-cigarette use. This year, the American Cancer Society pushed Connecticut lawmakers to raise the age for all tobacco products to 21. Governor Lamont signed that bill. But many feel, not just here in Connecticut, but all over the country, that more research is needed. Susan Raff, Channel 3 Eyewitness News.